Gabapentin, is it safe? And there's a lot of misuse and abuse now with gabapentin, which is the Neurontin painkiller. Tonight we're going to discuss this on The Best Diet for You. Get Moving.live here on YouTube Live. My name is Tom Jones, Pharmacist, and you are on Tom Jones, Pharmacist Live with My Wellness Train. And in the house tonight is Andy Doodle. Say hello to everybody on YouTube.
Hello, everybody.
All right. The misuse of gabapentin, Neurontin. Have you taken the medication yourself? Has somebody in your family taken the medication? Or do you know people who have taken the medication, gabapentin, Neurontin? Well, we're going to talk about, is it safe? And what about this new abuse thing that's popping up all over the place with gabapentin? You know, people will abuse lots of things. Alcohol, they'll abuse opioids, they'll abuse all types of prescription drugs, they'll abuse lots of things. But when it takes your life, that's when it's really, really bad. All right, let's talk about Neurontin, gabapentin. Gabapentin is Neurontin, Neurontin is gabapentin. That's the chemical and trademark name for this particular drug. And it's being used now for nerve pain. Has been for a long period of time. Emphatically, we'll go over exactly what it was used for and is still being used for. And we're going to talk about some of the chemical reactions in the body. So, why are people abusing the drug? Well, we're hearing it from law enforcement personnel and from healthcare professionals because we're witnessing a spike in the number of people who go to the emergency room and who are arrested and who actually have run into problems with gabapentin. So, what's the effects of gabapentin? What's the misuse and abuse of gabapentin? If you prescribe, if you're a doctor and you prescribe gabapentin for someone who is a regular patient and they use it according to instructions in a low dose, a moderate dose, or the dose that they are prescribed the medication, for the most part, gabapentin is a safe drug. It's when it's prescribed and not used properly, or when it's bought on the street, that it's a real problem. And the effects of a gabapentin high is actually an elevated mood or a feeling of euphoria. And it actually is a sense of calm, relaxation, and improved sociability. But here's the kicker. Here's the kicker. As with anything that's actually can be beneficial, when it's misused or when it's combined as a drug-drug interaction, first with alcohol. With alcohol, it can be a problem, huge problem. Alcohol potentiates the effects of the gabapentin, and when it's mixed with opioids. And when it's mixed with opioids, it produces that euphoric feeling, and it gives the person who is actually consuming the medication an opioid-like high, which is absolutely, unequivocally not good. So, again, gabapentin has a very good place in our prescribing and prescription filling process. The effects of it are good for the most part, but when you mix it with other drugs, and when you mix it with things that's going to harm you or kill you, then that's when it's really dangerous. So, safe when it's by itself or used properly. Unsafe always when it's used and abused. And generally, people who abuse drugs take too much. They think they will absolutely get along fine with it, but it's not going to happen. The effects of gabapentin high range from an elevated mood or euphoria to a sense of calm relaxation and improved sociability is when it's really, really bad. So they started noticing this 2 or 3 years ago, and the effects of misusing gabapentin sound harmless, but when you mix it with all these other items, such as the alcohol, you've got 2 depressants, and opioids, you've got 3 depressants, heroin, fentanyl, prescription painkillers. It increases the potency of that medication unbelievably high. And in a lot of cases, it will precipitate death. So many people have started misusing it to get high, the drug abusers, and increase the effects of the other substances that they're consuming. They're opioid users to enhance the effect of the medication. In certain states, it is a controlled substance, but in most states, it's not a controlled substance. It's fairly easy to find on the streets, and it's fairly inexpensive to purchase on the streets. So, we are going now to talk about the gabapentin approved and off-label uses. To give you an idea, what is an off-label use? That means it's a use that doctors have found that work, and it's not approved by the Federal Food and Drug Administration. They have not approved the medication for that purpose. Gabapentin was first introduced to the American market for people who had epilepsy as an anticonvulsant drug. And secondly, it's been approved by the American market for pain associated with shingles, because it does help the nerve-ending pain. And because it's been thought to be relatively safe, you've got a large number of off-label uses in addition to what we just have seen. They can include the following: withdrawal from other substances such as alcohol, cocaine, and methamphetamines, anxiety, mood disorders, and attention deficit disorder, sleep disorders, migraines, and back pain. So there's a lot of people who are critics of the off-label prescriptions, but really that's something that doctors have had the ability to utilize all through the years. So now with the opioid epidemic, it puts that all into suspect type issues. So it's been prescribed a lot. And taking an opioid for chronic pain is also a major issue. But when they mix, and I'm talking about the addicts, the users, when they mix it with gabapentin, it causes a major, major effect on the body, because people have a tendency to want to abuse anything that is mind-altering. And a lot of times that is readily available to them, and they learn this by the street. So you have to have responsible physicians who only prescribe the medication for certain situations. Now, the dose of gabapentin is 1,800 to 2,400 milligrams per day. That's the maximum dose for the medication. And the drug can be bought in, can be gotten in different strengths. 100 milligram 300 milligrams, 400 milligrams, 800 milligrams. So not all people who abuse or misuse gabapentin report a positive experience. A lot of them have the negative side effects of taking the drug. And those side effects include anxiety, headaches, rashes, nausea. So the common belief is that gabapentin is non-addictive. But guess what? That's not true with the drug abuse addict. Gabapentin abuse can be the result of a symptom of self-destruction behavior. And that's associated with depression and with other mental health issues that lead us into a state of addiction. Now, I don't want to mislead anybody, but not everybody has that propensity to actually develop that. But a lot of your drug users will run into major problems when they are taking the gabapentin. All right, we're going to keep going here. Now, is gabapentin an opioid? Let's talk about the pharmacology of the gabapentin. And of course, gabapentin is a prescription medication, and it's recommended for people with epilepsy to control the seizures. It's also prescribed to relieve the discomfort from a condition called post-herpetic neuralgia, which is a pain following a shingles attack. Shingles, by the way, is really, really, really painful, and the gabapentin can, in some cases, be prescribed to people who have nerve pain related to diabetes. So it's believed to work by balancing the electrical impulses in the central nervous system, which is responsible for a seizure and certain types of nerve pain. Another use is to relieve the symptoms of restless leg syndrome. And that's when the legs want to move by themselves. And gabapentin is actually thought to alter the amount of GABA produced, changing the firing of those electrical impulses. And GABA is a calming neurotransmitter that's emitted in the brain that reduces that excitement of the nerve messages. And also gabapentin slows the production of something called glutamate. And that's an agent that causes nerve excitement and is a contributor to the epileptic seizure. Gabapentin is available in a liquid, it's available in a tablet, and in a capsule. So it really is in multiple types of preparations, and it helps manage the symptoms that the individual is having as far as the nerve ending pain. There's an immediate release mechanism of action of some of the medications and an extended release mechanism of action of the others. And you take gabapentin several times a day, you actually will evenly spread out the dose. So when people get prescribed gabapentin, they usually start at a low dose, maybe 100 milligrams, once, twice, 3 times a day. Build that individual up gradually, because it can cause a lot of issues if you bring it up too rapidly. And is gabapentin an opioid? No, it is not an opioid. It is absolutely not an opioid. So the side effects of it typically are mild. They include drowsiness and dizziness and coordination issues, nausea, vomiting, double vision, jerkiness, and swelling of the legs and feet. And some of those symptoms will go away. The typical common ones go away pretty rapidly over a few days or weeks. So you talk to the doctor if you experience those over a long period of time. And you can have drowsiness relating to the mood of the individual also. So you have to monitor that patient's thoughts and behaviors carefully, because the mood symptoms that relate to the gabapentin sometimes will include suicidal thoughts and behaviors. And you could have even more anxiety, you can have more restlessness, and you can actually have panic attacks due to the gabapentin. So you can get aggressiveness, and you can get emotional type issues also. So gabapentin is not without side effects, therefore. So people often wonder, hey, is gabapentin an opioid? No, it's not an opioid. Opioids are a class of drugs known as narcotics, and they are habit forming. So gabapentin is a pain reliever. The primary use of opioids is to relieve pain. Gabapentin can lead to sedation, which is a major side effect of opioids, but when taken in high doses, it's possible to actually feel high with the gabapentin. So it is an effect also of the opioids. So there is a physical dependence that can relate from the combination of the two medications together. So gabapentin and opioids. The dependence isn't the same as addiction, but the addiction is a chronic disease when you're psychologically dependent to a substance. It's characterized by things of compulsive drug use and drug-seeking behaviors. So the scenario is when a person is physically, not psychologically, dependent on a drug, then they have more of a desire to actually be on the drug. And if someone is dependent on gabapentin with the withdrawal here and stops taking it suddenly, they may go through withdrawal. So people should only take gabapentin on the advice of their doctor. They shouldn't buy it off the streets. That is totally illegal, and you go to jail that way. So we are now over with our little program related to gabapentin and the opioid crisis. I hope you enjoyed this. Andy Doodle, say good night to everybody on YouTube Live.
Good night, everybody.
All right, we'll be back tomorrow. Thanks. Have a wonderful day, and we'll see you very, very soon.
My Wellness Train, all aboard. You are on My Wellness Train.